now. It's the only thing people are really talking about, this spike in these COVID cases. Dr. Kasseri, what can you tell us this morning about the surge? Did we think we would be here at this place?
Yeah, good morning, everyone. Sorry to be on the show. That means that things are, getting hairy. This Omicron variant, as it's called, is really taken over pretty much faster than any expert had predicted. We all were under the impression we were having a Delta surge with probably what was happening even early on in December was really an Omicron surge. And I think that's where all the cases are coming from. The CDC put out 70% of new cases across the United States now are Omicron. We're probably much higher than that in our area. We don't have data yet. It's probably 80 to 90% of new cases are Omicron, which makes sense with all the cases exploding because Omicron is much more highly transmittable than even the Delta, which was more transmittable than the virus from 2020.
Well, let's talk about those differences, because there are differences. There are differences in symptoms. There are differences in the way you're infected, how many days, and it's so concerning to people because they don't know that. They're not doctors. They're not the people in the labs. So talk to me about the differences. Let's first start with symptoms.
Yeah, so it's forget being a layperson. It's really difficult for us professionals to follow this. The typical playbook that we used for even the Delta variant may seem very different for Omicron. In other words, not only is it more highly infectious, it seems to cause illness quicker onset. Even with just casual passing of a patient who has Omicron, that you may not even know they have that. So, and the symptoms are really strange. 6 months ago, if I got a phone call, someone said they were lightheaded and they just kind of felt fatigue, I wouldn't recommend a COVID test. Now that seems to be the most common symptoms are, cough, I just don't feel well and I feel achy. And now you're COVID positive. So the symptoms have even changed. And that's pretty scary. So the onset of disease has changed. The symptom profile has changed a bit. And if you talk to most patients, at least I've spoken to, it seems to feel like the cold in patients who are fully vaccinated. And I want to highlight that.
We'll probably talk about this a couple more times throughout the show. What do people do? I think that's the biggest question now regarding testing. Say you feel like you have a cold. Say you feel a little tired with a little bit of a scratchy throat. Again, things that we wouldn't think twice about if this was 2 years ago, a year ago, with no loss of taste or smell. So they're so different and they're lesser. What should people do if they feel that?
My recommendation is get tested. And again, we can talk specific about what test you should get. Should you get a PCR? Should you get an antigen test? There's some nuances in that maybe we can go through later on. But if you're feeling at this point, since we know, this is all preliminary, any new signs and symptoms you have should really prompt, you getting a COVID test.
Well, let's talk about that testing. We've been seeing, as we were just looking at videos there, just lines wrapped around these city MDs on these urgent cares, people waiting online for hours, not being able to get appointments, not being able to take off of their job or leave their kids. I don't know if there's any other solution other than you just got to do it.
Yeah, well, let me just make a comment. This literally came on us like a tsunami, with very little time to ratchet up testing sites and even prepare for this. We're playing catch up, and I think again, I'll highlight this. The tsunami of Omicron has really overtaken our testing abilities. If you feel ill, you should get tested. If you can't get tested, you should treat yourself as if you are infected and quarantine yourself from loved ones and maybe not even get together for the holidays. I would recommend getting a test if you can.
That's something, and I think that a lot of people online this morning and all these days that we've been seeing these long lines are those maybe people who are not sick, just trying to make sure before the holiday. And that's something I really wanted to ask you is testing is almost impossible right now if you can't wait those hours online or have a test at your home. What do people do if they can't get tested in time? Do they not go to that Christmas celebration with their family?
Well, let me just give you a little context. Back where Omicron really hit Oslo, These people went to a get together in a private room. They all were fully vaccinated. They all had negative COVID tests, walked into that. Over 70% of them got COVID. So the reason why I highlight that is if you're feeling any signs and symptoms and you do not and you have a family get together, I would encourage you. And again, this is not going to be a popular comment right now.
Right.
Is going to be you're better off not congregating. And we have to go back to those 3 C's that you and I probably spoke about a year ago. Stay out of closed spaces with poor ventilation, stay away from crowded places, and stay away from close contacts. It's really scary, but that's just the facts, unfortunately.
And it may not be so much of healthy younger or even healthy older Americans. It's the people that you may infect that are immune compromised, who have maybe, got past that first COVID wave or the second one. And now this third one could do something to an older person, a grandmother, a grandfather. It's those people. You may feel like you just have an itchy throat, but it could be COVID, and you could be making it worse for some certain people in your family.
Yeah, and not to complicate things either, but influenza A is also making a big splash in our area. So again, and you could get really sick and die from that. So any signs and symptoms, whether it's COVID related or not, it may be influenza A, which is turning out to be a really severe disease as well. So I know it's a very unpopular comment to make, but you may want to steer clear from family get-togethers. And again, the definition of what fully vaccinated means will probably change because of Omicron.
Right, so we're talking fully vaccinated, both shots, and a booster. Is that what we're calling fully vaccinated now?
Yeah, and I know I'm going to get tomatoes and vegetables thrown at me for saying that, but I have to tell you that that's probably going to turn out to be the new definition of fully vaccinated, and that's just science and the data. We don't want that to happen. This is just happening.